everyone. My name is Muhammad Raid. I'm a patient of a stage 2.5 lymphoma. It began in early 2025 January. I had a swelling in my neck. So back in Maldives, I did a CT scan and it revealed this cancer near the lymph nodes near my neck. So they recommended me to go abroad into India, Bangalore, specifically this hospital. And there I traveled and met with Dr. Vishwanath, the onco department. So he devised a plan of 6 cycles of chemotherapy. So I underwent chemotherapy. It was a very tedious matter. I had some complications with my lungs and my bowel systems, but I powered through it, thankfully. And a good chunk of my lymphoma has been reduced. But unfortunately, after some months, it is found out it relapsed again. So we went for a decision to go for CAR-T therapy. And after some months of deliberation and hard work, I underwent CAR-T therapy.
Hello all, I am Dr. Vishwanath, Senior Consultant and Academic Advisor in the Department of Medical Oncology at Apollo Hospitals, Bangalore. I am also the Lead Oncosciences for Karnataka region. Today I am going to talk to you all about a very unique, challenging and complex case which we treated recently at Apollo Hospitals, Bangalore. We had this 25-year-old gentleman who came from Maldives who was diagnosed with high-grade B-cell lymphoma. We treated with the conventional chemotherapy. Subsequently, he had a relapse, which was then managed with salvage chemotherapy, only with a partial response. We wanted to adopt this procedure, which is called autologous stem cell transplantation. But unfortunately, we were faced with another challenge that we had inadequate stem cells, which did not let us proceed with the procedure called autologous stem cell transplantation. Furthermore, his clinical scenario was complicated by pulmonary tuberculosis, which made it very challenging. This complex situation of relapsed B-cell lymphoma with intercurrent infection of tuberculosis made it a very unique and challenging case for us. At this point in time, we decided to go ahead with this very novel procedure called CAR T-cell therapy, also called as chimeric antigen T-cell therapy. So he underwent a T-cell collection and then underwent chemotherapy. CAR T-cells were infused back. He sailed through it without any major complications like cytokine release syndrome or other neurological complications. I would like to conclude by saying that we have this procedure called CAR T-cell therapy accessible at Apollo Hospitals, Bangalore, and we have a wonderful team of experts to manage such complex and unique clinical scenarios.
I am Dr. Sireesh CH, medical oncologist practicing in Apollo, Bannerghatta Road. So now I will be talking about the indications for CAR T-cell therapy. So which are mainly blood malignancies like B-cell ALL, multiple myeloma and non-Hodgkin's lymphoma, which also include many varieties of lymphomas. So usually the practice is, it's not an upfront therapy. Usually when there is relapse or recurrence of lymphomas or BALL, we usually go for CAR T-cell therapy post at least 2 to 3 lines of therapies. Whereas other indication for CAR T-cell therapy is failure of the primary first line treatment. So usually it is done, failure is there within 1 year, option of CAR T-cell therapy is there in lymphoma. So these are the main indications for CAR T-cell therapy.
I am Dr. Poonam Maurya, Senior Consultant Medical Oncologist and Hemato-Oncologist and BMT Physician CAR T-cell expert at Apollo Group of Hospitals, Bangalore. So CAR T-cell therapy is a novel form of therapy for treating hematological malignancies. It is also known as chimeric antigen T-cell therapy. So what is exactly done in this procedure? So patients' T-cells are extracted from the blood and it is then genetically modified in a lab to empower the T-cells so that when reinfused to the patient, these empowered genetically modified T-cells kill the remaining residual cancer cells. And this is how we enhance our own patient's own immunity to kill the cancer cells. This is really a welcome step in treating hematological malignancies.
I'm Dr. Kalyani, consultant medical oncologist at Apollo Hospitals, Bangalore. CAR T cell therapy is a novel therapy for treating hematological malignancies. In India, the cost is 1/10 of the global cost. That makes it relatively more economical and accessible. India has now transformed this treatment from a crore level treatment to a lakh level possibility. And we are happy to introduce this treatment at Apollo Hospitals, Bangalore. Thank you.
Now I'm 100% sure that I'm fully cured, and I want to thank Dr. Vishwanath and his team for their hard work in curing me. Thank you.